Kick back and watch the FIFA Women's World Cup this season. Keep in mind, soccer players are certainly likely to undergo injury, and we've seen it happen in most of the games so far this year. So our good friend Dr. Ray Solano is joining us once again. We're talking about some common injuries. Yes, they occur in soccer players, but they can also occur in weekend warriors and the rest of us. So we're going to learn more about how we can get the best treatment, and then you're going to stretch me out and some stretches that people can do at home too, right?
That's right, Steve. Yeah, absolutely.
What do you have? You brought the tech today. So what's the latest in treatment?
So a lot of times in my office, especially with soccer athletes, we are seeing training injuries. So we're seeing a lot of soft tissue injuries. We see a lot of inflammation, see a lot of tension. And in my practice, we use a variety of different things depending on what they present with. This here is a deep tissue laser. It's cutting edge. It's fantastic for inflammation reduction.
So what can you see with that?
So with this particular unit here, we're actually hovering the laser over the inflamed area for about a 10-minute treatment. It pushes inflammation out, brings in oxygen, more blood, promotes healing, sometimes cuts the recovery process in half.
Oh, that'd be great.
Some people come in, they need something to go after those deep, tight bands. We're using dry needling. It could be muscle scraping. Cupping is pretty popular in the office. So it all really does depend on what they come in with, the mechanism of injury, or the location of the injury, how to address it.
How do you know, like, if, I mean, you know, because this is your job, but if something needs the dry needling or it needs the laser, like, what do you do? Is it the severity of the injury or is it where it is?
Yeah, two things, actually. It's the severity of the injury and the length of time they've had the injury. Length of time, if they've had their problem for a long period of time, if it's a weekend warrior that's got a hamstring strain that has not responded to traditional massage and stretch, a lot of times we'll put needles in there. The needles have been a game changer for releasing those deep, tight bands of muscle, and then we incorporate things like the laser, maybe some cupping and stretching.
How long is a treatment like that with the needles?
The needles typically, in my office, about 10 or 12-minute treatment. We put the needles in, we connect a TENS unit, which is a low-volt current, to the needles. We send that current down into the tip of the needles, and it provides an electrifying experience, Steve.
So, Ray, my next question, and then we've known each other for years, what's the pain factor in something like that?
You don't feel the needles go in, but I'll be honest with you, once the needle is in, you get what we call a twitch response. So a little cramping, 3-4 seconds of discomfort, but I tell you, when the needles come out, you feel like a new person.
You feel great. You feel great. Cupping is big, and you'll see sometimes if you go to the gym, you'll see the people with the marks on the shoulders, the leftover. Marks. Exactly. How does that help?
Yeah, so cupping is great, and cupping really, truly is the only form of manual therapy that actually pulls the tissue. If you think about it,
so is it a suction thing? Like
it's suction, and yeah, it is suction. So if you open your hand,
just do that.
I'll just show you what that feels like. So we put the cup.
Ooh, you feel that immediately. Oh, you can see the skin is actually bubbling up underneath there.
So cupping therapy is the only form of manual therapy that actually pulls tissue this way.
So what does it do then? It just
releases... as it releases the tissue, the layers of tissue, because tissue come in several layers, it releases it, allows for more blood to come in, increases oxygen, brings more nutrients to the area. It's been around for a long time, but very, very popular in sports medicine
Ray,
today.
I did not come just to sit on this right here. I want to lay down and I want to get comfortable. And while I do so, work me through some stretches that we should be aware of at home.
I've been thinking about this all weekend, Steve. I've been looking forward to this.
Too much information, Ray.
All right,
too much, but let's start with the basics.
So this is just so you get a good understanding. This is a lot of times a fraction of the treatment in my office, in addition to some of the other things. So I'll show you one stretch we do in the office a lot to get that hamstring involved. And by the way, you're just relaxing.
Okay. I have no problem with that whatsoever.
What I'm going to do, Steve, is I'm going to bring you to tension, and I'm going to just bring you into some circular motions because I already feel right here you guarding.
A little bit, yeah, push back.
I'm going to go into some circular motions, and I'm going to ease into it right there. What does that feel like?
I'm feeling a little tension.
Okay.
But it feels better than it did a minute ago.
So what I'm going to do now, so that I can get the inside of that hamstring, Steve, and that groin area, I'm going to point your toes out and let your leg fall out that way. Look at that.
Yeah, I'm definitely feeling it in here now.
Right in there. And same thing here. I'm just going to go into some circular motions. What I'm trying to do is just interpret what
Ray,
the muscles
we can continue this for like 30 minutes after the show is over. Show me one more real quick.
Absolutely. So then what I want to do, if I want to go after the back of the hip and even the lower back, I'm going to bend the knee. And then I'm going to rock you this way. Don't worry, I got you, Steve.
And I just go with you? Oh, that feels good.
And you just relax the entire time. Same thing, some circular motions, get you a nice stretch in your lower back. I just felt something move back there. No charge for that, Steve.
No. I'm surprised you didn't hear the loud cracks through the microphone.
All right, that was a freebie.
And then Marissa, Ray's going to keep doing this.